So for the second time, I've already came in, washed my hands, introduced myself. I did my assessment. Okay. Where do you want to have drainage or fluid build up? Left.
Superior apical.
Of what lobe? The lower
lobe.
lobe. Okay. Left superior apical segment of the lower lobe is where he has issues. Off the table real quick. Time out. Who has the risers? Somebody grab me some risers.
Oh, you mean the risers that go in?
Yeah, the table risers. Sit down yet.
Hans is start the show.
It's going to be a new YouTube sensation.
Alright. So, dangling feet. I think your feet still may dangle. We did enough. Skip forward just a little bit so your feet are flat. Okay. Alright, so I've already introduced myself. I did my assessment. I found superior left superior segment of the lower lobe of the lung. Yeah. Okay, so I'm going to do my treatments. Okay, starting from there. All right, Hans, I just want to assess your cough and see how you're coughing, because I'm going to teach you how to cough before we put you in a position. It'll help get some of that mucus up and out of your lungs to help you breathe a little bit easier.
Right.
Okay. So what I want you to do is I would like you to breathe in through your nose, turn your head, and then cough twice for me. Okay, we're going to work on that a little bit. So what I'm going to do, the purpose of coughing is to get that mucus up and out. Okay, here's just speaking up. Let's see if you might have a lot. All right. Okay. So this time, what I want you to do, can you sniff for me? Put your hand right here, a little bit higher. Can you feel that kick in? This time, just hold your hand there, and when you cough, this time I want you to try to concentrate on having that muscle move the same way. Okay. So breathe in through your nose, turn your head, and cough twice for me. Okay, a little bit better. A little bit better. This time, try a little bit harder. Try to kick that muscle in just a little bit more. All right. Okay. This time, add a little bit of pressure. So I'm going to put my hand on top of yours. So go ahead and leave yours there. Okay. Breathe in through your nose and cough twice. There you go. And one more time. All right. Still a little weak. So now what do I do?
He has to bend over a little bit.
Okay. So this time I'm going to have you bend forward. Okay, and breathe in through your nose and cough twice. Okay, so we're going to say he has a productive cough, because if he can't cough at that point, then he needs too much assistance to put him in a drainage position. Okay, so good coughing. All right, so we're going to put this over here. All right, like I said, what we're going to do now is we're going to put you in a position, and what happens is it's going to have gravity pull that mucus out of your lungs. Okay, so we're going to use the force of gravity to help get that out of your lungs. While you're there, I'm going to kind of percuss on that area, which is kind of like playing the drums on that area. And then I'm also going to vibrate to help move the mucus up and out so that you can breathe a little bit easier. Okay, if any time you get dizzy or feel faint, you need to let me know. Okay, if you get down and you need to cough before I'm finished with the actual procedure, you just let me know it's okay to cough. We'll get the sputum cup for you and you can go ahead and cough. Okay. Once you're down though, we'll stay in that position. You'll just prop up on your elbows and cough, and I'll help you when we get to that point. Okay. Any questions? Nope. Let's see. Superior apical. So what I need you to do is that you're gonna lay down on your stomach, one pillow under your stomach, and then if you need this, we'll see how you feel. You may need this for your head. Okay. So go ahead. The computer's out of your way. Okay, go ahead and lift your feet for me. There. All right. Does that feel okay?
Mm-hmm.
Okay. Do you need another towel under your head right there, or does that feel comfortable?
Oh, that's good.
Okay. Let your arms hang off to the side. Okay. And it was his left. I did say left, correct?
Yes.
I'm gonna do is I'm just gonna tap on your back. Okay, it's gonna sound really loud, but it shouldn't hurt. So let me know if it hurts. Okay, it's gonna sound like a drum. All right. How long?
3 to 5 minutes.
Okay. Now that it's been 3 to 5 minutes, what I want you to do is I want you to breathe into my hand. There you go. And then breathe out in your mouth. Good. And in through my hand. And out. In. And out. All right. Push my hand away. And out. How many times? Okay. Are you feeling okay?
Yep.
All right. Now that we've done that, before we go to the next segment, what I want you to do is I want you to prop up on your elbows for me. Okay. I would have gloves on, and then I want you to take a breath in through your nose, turn your head, and cough. Okay. Collect the sputum. Note it. Okay. And then lie back down. What you can do instead of having to write down is just have them collected all in the same tub, bin. What is the name of this thing?
Basin.
Basin, thanks. Collect it all in the same basin, and then at the end, just the total amount that you accumulate. Okay, you can lay back down. So we didn't get a whole lot up, so we're gonna do that segment again, okay? Or if there was a different segment, I would position him in a different position and do that segment. How long can you do this before you have to stop? It's on your sheet. So you can do multiple positions, but how long can I keep doing the treatment before I have to stop?
30 to 45 minutes?
30 to 45 minutes. Okay, and you need to monitor them the whole time so that make sure that they're doing okay. And it's really hard. Remember how I said you want to be in a position where you can see their face. But when they're face down, that's maybe hard to see. So you may have to ask them questions the whole time. Are you doing okay? How's everything? Does that feel okay? I mean, just talk, if you get going, just ask them a question. That way you know if they can respond to you that they're doing okay. Okay? Any questions about that? Okay. All right, we're all done. So let me help you get up. Okay. He's a great patient, so I didn't have to give him any support because he's healthy. All right. Now, what I want you to do is just sit here for a minute because you've been head down for a while. Are you feeling dizzy?
No.
No? You feel okay?
Mm-hmm.
All right. You may go. So when you get done, you need to make sure you have him sit there for a few minutes and make sure. Now, he wasn't down for 45 minutes, so he's okay. But make sure that they're not dizzy and that they can acclimate. If they have cardiac issues, good time to take vital signs, right? When you get done with your treatment.
Mm-hmm.
So you may want to take all your vital signs at this point, make sure everything's back where it should be, because you know how you can get dizzy from lying down and setting up too quick. So you want to make sure they get up slowly. All right. Yeah.